Welcome back, viewers at home. You're certainly joining us right here on Prime Live. Joining me for this conversation tonight is Dr. Zaheer Essop, a valued member of IMASA, the Islamic Medical Association of South Africa. And in our discussion, Dr. Essop will provide essential insight into the free basic life support training program offered by the Islamic Medical Association of South Africa, and also highlight the importance of empowering individuals with life-saving skills, raising awareness about health issues, and promoting stronger bonds between faith-based organizations and their communities. Now, assalamu alaikum, jazakallah so much, Dr. Essop, for joining us this evening.
Walaikum salam wa rahmatullahi wa barakatuh. Thanks for having us.
Now, before we get to the kind of skills or rather life-saving skills that individuals will be getting from joining the program or being part of the program, can you take us through the motivation behind, offering this free basic life support training to the public?
Bismillahir Rahmanir Rahim wa salatu wa salamu ala Rasulillah. So, doctors, as you know, I'm a doctor, and we get lots of phone calls, people phoning and saying somebody has collapsed at home. Most of the people in our communities collapse at home, in a shopping center, in a masjid, and by the time the doctors come, it's usually too late. So, usually by the time we get there, the patient is already demised, or by the time we revive the patient, it becomes such that it takes longer to revive the patient and there are complications afterwards, and the patient survival rate is very low. When it comes to CPR, time is essential. Every minute we wait means that we're losing the patient. So after 10 minutes, it's almost futile to start cardiopulmonary resuscitation. And there is the motivation between us, the Islamic Medical Association of South Africa, and the international organizations. So our brothers in Palestine and the other doctors in the British Islamic Medical Association, we formed this international federation, and we made this project called the Female Lifesavers. And this is a project that's basically based on teaching this life skill free of charge in masjids, in community centers, to people who need it the most. And the people who need the most, like we said, is the people at home, is the people in the community centers, is the imam, is the taxi driver. And that's where we want to get this message of CPR, cardiopulmonary resuscitation.
And thank you so much for that insight, Dr. Essop. And I think I'd like for you to talk us through the program in terms of what the day it will entail. Is it a one-day thing, two-day thing? And basically just walk us through the program.
So, in all the regions of South Africa, so in Cape Town, for example, Guguletu Masjid, in Durban, in Joburg, in Benoni, there's about 15 centers throughout the country. During the last week of September, we have this, what they call the Female Lifesavers program. And what it entails is three basic life saving skills. So, the one is we're going to teach you how to do cardiopulmonary resuscitation, which means, if you know, for the people they don't understand, is that pressing on the chest. It's artificially pumping the heart from outside so we can get blood supply to the brain. And as we get blood supply to the brain, the survival increases. So cardiopulmonary resuscitation. The other important skill we're going to teach is choking. As you know, with choking, you've got a few minutes. If there's a total obstruction, eventually you will collapse and end up with a cardiac arrest. And the third important skill we'll be teaching is how to place someone in the recovery position. So many of us have got old people at home, or we've got kids at home with chronic conditions where they have epilepsy or where they collapse and they lie flat on their back. And I'm sure we've always heard the story of, oh, you're going to swallow your tongue. So nothing to do with swallow your tongue, you obstruct your airway. And so basically, we teach you how to put that patient in the recovery position, which is a safe position for the patient to then slowly recover as they start responding. So the three skills we'll be teaching is cardiopulmonary resuscitation, CPR. As you can see, those ladies are busy doing that. And the other lady behind there, can you see? She is doing the recovery position. And the third skill we'll be teaching is choking.
And with that being said, I know earlier on you did share some of the, challenges that doctors face when they are called to maybe an incident or just a house call in terms of, my grandmother or a loved one just, collapsed. It's a matter of it's too late and a lot could have been done, if the family members knew what to do. And I think I want to find out from you, Dr. Essop, in terms of with individuals signing up for such classes and for such programs at that, what does this mean in terms of how does it impact the wider community when every individual in the community knows CPR or just understands what to do when somebody collapses or when somebody drowns, even at that when somebody's choking?
So I think the main vision, our main vision, what we want to see in life, South Africa and throughout the world, is if somebody collapses for CPR, everybody around them, all the bystanders, know exactly what to do. As I've said, 1 minute, every minute we wait, there's more danger in terms of how you can, your survival rate, it impacts your survival. So we want every single person in South Africa to have this basic life skill of CPR. The same way as we want every person in South Africa to know how to swim to prevent drowning, we want this to be a basic life skill. It needs to be taught in mosques, in churches, in community centers, at schools, in the madrasas, at home, just so that if somebody collapses, and we teach this skill from 7 years old to 90 years old, everybody can do CPR. We just adapt it. So if somebody collapses at home, even with a child, that child will know what to do. If somebody collapses at a shopping center, we've got this. They always say in South Africa we like to watch. If somebody collapses, the crowd forms around there. They all take out their cell phones and they say, "Let's phone the doctor." But nobody gets onto their chest, and nobody starts CPR. And we want it to come naturally. It must be instinctive. It's a very emotional thing when somebody collapses. People are scared. You don't know what to do. You're worried about this person passing away. It might be a relative. It might be not a very clean environment. You might be worried about yourself. So once you know what to do, you've learned the skills, you're confident now, you start the process.
And Dr. Asab, with regards to being a helping hand, I believe that also with the training there is a part where it says you need to seek, consent. What happens now, or what advice would you have for, community members who going to be signing up for the program or have previously went for, basic life support training, if not first aid training, in terms of how do they engage such a situation? Because you'll find out that most of the panic is from, I don't want to be held liable. How do we move, beyond that fear?
So the one reassurance we want to say is that there's something called the Good Samaritan law.
Mm.
So this is a life or death situation, and no matter what you do, just because you're helping, you will never be held liable. So nobody has ever got sued for trying to CPR somebody. I'll give you a simple example. I don't know if you know about the park runs every week. And last year, winter, an old man collapsed. And we ran up to him. I had no consent from him. He's unconscious. You can't find the family. Immediately, we started CPR. We started CPR immediately. By the time the ambulance came, Alhamdulillah, he was revived. 2 days later, he went for a bypass and he survived. And his daughter actually contacted us to say, if you didn't start CPR immediately, consent or no consent, my father would have been in a different place. So I think as far as life-saving CPR is concerned, there should be no fear from the public to not get involved. The first thing you do is look for danger for yourself. So obviously, if you're in the middle of the highway, don't run and do CPR, and that's taught in the course.
Yeah.
But never be shy to get involved. Everybody can do CPR, whether you've got old, young. We've got ways to adapt it if you are weak, but ways to adapt it if you can only use one hand, that type of thing. So it's a life skill for everybody. And that's very, very important. Just to reassure the people that there's no such thing. You will not get sued if you initiate CPR on somebody.
Dr. Esop, Jazakallah so much for that reassurance. And I think just moving along from that response is if you could kindly tell us about some of the common misconceptions around basic life support and that of, first aid that people are sort of prone to hear and prone to do. Because I know usually growing up, when somebody was burned, there was a conversation of using Colgate and flour. But I believe that sometimes can cause more harm than good.
Yes. So I think there's lots of old wives' tales. Like if somebody has an epilepsy, they say you must put the spoon in the mouth and that type of thing. And I think there's lots of stories, but I think the best way to overcome these old wives' tales is to basically learn it. So very, very important. If a person burns, the most important thing with a burn is to keep the wound clean. Why? Because that And the easiest way to do it, the safest, the easiest, the cheapest way to do it is to simply put water over it. So go back to the basics. If somebody has epilepsy, turn him on his side. If you've done the course with us, place him in recovery position. So I think that's where the community education needs to come in. Generally speaking, the safest thing to do if somebody is burning, make sure you put water on the wound and seek help immediately. If somebody has, for example, an epileptic attack and you don't know anything about it, turn the patient on the recovery position and seek help. The message we want to get across is don't not get involved, seek help, and initiate the process. And really, I want to encourage everybody. There's lots of causes. You know, the Female Lifesavers course is run in 22 countries. And I'm proud to say our African brothers and ourselves take up the bulk of those countries from Uganda and Kenya. And it's ladies involved in the CPR and it's children involved in the CPR program. And we train people on the last week of September in 25 countries in probably about 2,000 masajid and community centers throughout the world, which means every year you're getting 30, 40, 50,000 people learning the skill. It's not difficult. It's not an exam. It's not a pass or fail. It's not intimidating. It's actually a lot of fun. So, I mean, look around at the nearest center that you've got, Joburg, Cape Town, we've got in Google to Masjid if you're somewhere in Cape Town. And basically look at the socials, find a spot for yourself, join it, and really it's a fun day out. It's a fun day out for everybody. You get to practice, you get to meet your neighbors, you get to learn a new skill, and you get to go home and pass it on. You know, we had one or two testimonials. I think it was last year or the year before. One of the ladies learned choking, and 2 days later, in a restaurant, somebody choked and she managed to use the technique, and Alhamdulillah, the patient survived. So I think our message is join Female Lifesavers and don't be afraid to get involved.
Now, Dr. Essop, previously we've had conversation in light of the incredible work that the Islamic, Medical Association of South Africa has been doing in terms of creating awareness, sharing knowledge, and just creating a space of networking between doctors and those within the healthcare fraternity in terms of sharing ideas and, solutions to the wider issues that we have. And I think this makes me wonder and ask in terms of how exactly does the basic life support training or program at that fit into the vision and mission of that of IMASA, and most importantly, with regards to seeing that it's all around, health, providing healthcare services and health education in South Africa.
So the Female Lifesavers project forms part of what we call the patient care and patient services part of IMASA. Part of that we have what they call the IMASA clinics, where we provide free clinics, especially in the KZN area in Cape Town, to thousands of patients every year. Um, and then we've got another arm of it where it's patient and health education, and Lifesavers falls under that banner. Then we have another part of IMASA where we provide relief work. And part of the relief work is local relief work in terms of free medical camps, in terms of providing relief, as in social relief. And then we work internationally as well with partner organizations to provide relief in war-torn areas, for example, Gaza, Sudan, that type of thing. And then the other part of IMASA does what they call health education to doctors and medical professionals. Because as you know, we represent about 3,000 medical professionals. And so that part of it, what we do is we teach doctors how to, for example, like the CPR course we do, we have an advanced course for doctors. The doctors want to study about kidney disease, we have continuous medical programs. Every year we have a massive national convention where all the healthcare workers get together and we have a solid program, 3 or 4 days, where we teach different skills and different techniques and have important ethics discussions and learn from each other at our national conventions. And that's part of now the healthcare. And then we have advocacy. For example, now with the Gaza thing, or with our patients, let's say one of the hospitals doesn't have medication or whatever the case is, then we engage the stakeholders. We with advocacy, we try and encourage them. We try and find a solution where we engage the local healthcare services or the national healthcare services, or in some cases, for example, with the Gaza, to send out correspondence to the international doctors to try and get help. So we do advocacy, we do doctor education, we do relief, we do patient education, and we supply medical services.
And with that, Dr. Essop, what is IMASA's aspiration for the future of the free basic life support training program, and how do you see it evolving and making a lasting impact in South Africa?
Well, we want to see long term every single person in South Africa being able to safely administer CPR. It must become second nature to every single person in South Africa. That is the vision. We've trained about, let's say, about 20,000 in the last 5 years. We've still got another 50 million to go, inshallah.
Inshallah, inshallah. Dr. Essop, Jazakallah so much for joining us. Is there any closing thoughts that you'd like to share with, our viewers at home regarding our conversation on all things, basic life support and training?
Well, I just want to say that we'd like to thank you for inviting us, for hosting us. And my message is just get involved. Get involved in your local clinic, get involved in your local mosque. Everybody has got some way that they can access this, the basic life support. Make it a part of their lives, make it a part of their skill set. And it's something that's accessible for everybody. So I think in parting, what I'd like to say is get involved. If you're scared of administering CPR, then volunteer. Volunteer at your local screening, volunteer at your local. And it's very easy to get hold of the Islamic Medical Association. Search us on socials, and our marketing manager will get back to you very, very soon. Jazakallah khair.
Jazakallah
Allah
so much,
bless you.
Dr. Essop, for that conversation and enlightenment, as well as education and sharing us in terms of, what we still have to do as community members in terms of equipping ourselves with such important skills that can actually save a life. Jazakallah so much for joining us.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Viewers at home, that was Dr. Zaheer Essop, a valued member of IMASA, the Islamic Medical Association of South Africa, who was truly sharing in terms of the benefits and the purpose driving, the program being given for free to the public on basic life support. Hope that was helpful to you, and hoping that you will be part of the individuals who will be taking part in this training. But